Dr. Diana Rowan, thank you so much for joining us today. It's such a pleasure seeing you.
Good to see you too, Roger.
Dr. Rowan, we're celebrating social workers this month because it is our month. It is March.
Yes, it's March.
Really, I think we should be celebrating social workers 365 days a year. However, I'll take a month. So let's do it. We're doing 31 interviews.
Okay.
31
Happy to be a part.
Yes, 31 interviews, 31 social workers, ranging from our faculty, our students, community activists, community advocates, anybody related to social work in UNCC. We're spotlighting alum. So we're spotlighting you because you are a fantastic faculty. You're also a champion in the community. And we want to know a little bit more about what you're doing. So if you could share with us, because we're going to share this on all our social media platforms, Instagram, LinkedIn, Facebook, Twitter, anything that you can think of is going to go out there.
Okay, but no pressure though, right?
No pressure, no pressure. So what are you currently doing as a social worker? And then if you could tell us, what do you feel like is a lesson learned as a social worker? What is a lesson that you've learned as a social worker?
Okay, well, that's a lot of questions. And what our students would tell you, Professor Saklupe, is that was a triple-barreled question. You gave me 3 things to answer all at once. Okay, so what do I have going on? I'm very excited that now that I'm not directing the MSW program, it gives me a little bit more time to kind of return to the trenches a little bit. I'm seeing a few people in the community that are veterans, mostly women veterans, just around PTSD symptoms and such. So that's really exciting for me. I'm also interested in, as usual, HIV prevention work and also sports social work. I'm very proud to be an inaugural member of the Professional Association of Social Workers in Sports. So that is a cutting edge area, a new frontier in social work. As usual, in spring, I'm teaching our capstone course. And if there's any of our graduates that are watching this on all those social media platforms, they remember the capstone course if they were in the MSW program. And I just wanted to share with you some of the exciting new topics that they have come up with this year. And just we have one student who's looking at embedding social workers with law enforcement and mobile crisis teams. So that's certainly cutting edge. LGBTQIA plus youth and trauma, school-based restorative justice practices rather, reducing childhood obesity, right? So that's a good example of how social work interfaces with health and wellness. Racialized trauma, advocacy for school-based sexual health training. So we've got students, in all different areas, micro level topics, macro policy oriented, in some new areas, such as the forensics, which is the interface with law enforcement and the legal system. We have one student that's looking at menstrual hygiene internationally, which also highlights the fact that we are a global profession. So I'm really excited about our students and what they have going on.
Wow, that's incredible. All those topics, and so important for us social workers to be embedded in all those different areas that you just mentioned. Dr. Ron, I have to say that students find inspiration from you, from faculty who are so invested in them. That's why they are looking at social work from a very different lens. And we just appreciate that you bring that to the classroom. So Dr. Rowan, what would you feel like is a lesson learned, in social work, as a social worker that you've been in the field? What's a lesson learned?
Yeah, I think the biggest lesson learned is don't quit. like stay engaged. Like if you get knocked down, just keep getting up, like show up, just keep showing up. If you don't know what else to do, just show up to the fight, right? Just, and strength will come, inspiration will come, a team will come, but we can't shy away from battles. So
You know what?
that would be my lesson.
I think you just created a new t-shirt. Social workers show up. How's that?
Yeah, you know what? You know what? We do show up, and I'll give you an example. Anybody who knows me at all knows how passionate I am around HIV prevention and linkage to care. And social workers are the very first profession that took off their gloves and masks when people were in the hospital dying of AIDS, you know, back at the start of the pandemic in the 80s and such. We had people dying in hospital beds alone because their families wouldn't come. Other medical providers wouldn't come in and understand the value of the human touch. The dietary trays started stacking up, and it was the hospital social workers that showed up in the rooms, took off their masks and gloves, and sat with these folks. So yes, we have a long legacy of showing up.
That's a great, I think that would be a great t-shirt. So Dr. Rowan, you know I like to have fun. We're going to have a little fun here. We're going to play a game called Fab 5 in 5 seconds. So you get to tell us your favorite 5 things in 5 seconds. It could be anything that's your favorite pet, your favorite place to visit, your favorite car, whatever it is, but it's all about you. So
Okay.
Fab 5 in 5 seconds on my go. Ready, set, go.
My favorite car I had was Pontiac Firebird. My favorite food is Popeyes. And my favorite place on the earth is Lake Malawi. And my favorite animal is turtles. And sport is watching football.
Excellent. That was great. Dr. Rowan, thank you so much for taking time out of your busy day to spend with us so we can not only celebrate what you're doing, but celebrate what your students are going to do here as they finish up capstone.
It's all about the students, Roger. You know that.
Yep. But remember, we need to highlight you as well and all social workers out there who are doing things in so many different areas, whether it's in academia, whether it's in the community, whether it's wherever it is. Social workers make a difference. Social workers show up. So Dr. Rowan, thank you so much. We wish you a happy Social Work Month. Thank you for taking time.
Happy Social Work Month. Show up.
Show up.